In this short video presentation, I will talk about why cleft lip and cleft palate occurs. So, cleft lip actually occurs due to a defect in development of the lip. That's very easy to understand. But why the defect occurs? So when your lips develop, it actually develops from two sides, which are called maxillary prominences. So here you can see on two sides we have maxillary prominences, and the middle part of the upper lip actually develops from something called medial nasal prominence. So if there is a defect in fusion of those two structures, meaning that if the medial nasal prominence cannot meet with the maxillary prominence in either side, it will lead to development of a cleft lip. And the medial nasal prominence is also known as intermaxillary segment. So also remember that. So here this baby actually failed to fuse his intermaxillary segment with the right maxillary prominence, leading to a right-sided cleft lip. Cleft lip lesions are commonly associated with the cleft palate lesions. So here you can see an inferior view of the palate. So you have your teeth here, and you can see the palate from inside your mouth. So actually the palate develops from two parts. So here you can see the secondary palates, which are the posterior part of the palate, and the frontal part or the anterior part of the palate are called primary palate. So the primary palate actually develops from the intermaxillary segment or the medial nasal prominence. So the medial nasal prominence generally gives rise to this primary palate, and the secondary palate actually develops from the maxillary prominence. So maxillary prominence actually extend up to anterior posterior direction, and they actually gives rise to palatal shelves from two sides. So the right maxillary prominence gives rise to right palatal shelf, and the left maxillary prominence gives rise to left palatal shelf, and ultimately they will fuse. So whenever there is a defect in fusion of the palatal shelves, or whenever there is a defect in fusion between the primary palate and the secondary palate and the primary palate, there will be a cleft palate. So that's all. Thanks all for watching my video.